If you have hip arthritis, you may have trouble putting on shoes and socks, lifting your leg to get in a car, getting up from low chairs or toilets, or squatting down to pick things up from the floor. I'm Dr. Dave Candy, and in this video, I'll give you 2 tips to instantly improve your hip mobility. And if you stick around to the end of the video, I'll share another tip to help further improve your mobility. So first of all, why do people have trouble bending down when they have hip arthritis? Well, your hip joint, when you bend down to pick something up or when you lift your leg to get in a car or put on shoes and socks, goes through a motion called hip flexion. When you observe this as an outside observer, it looks like the knee is coming closer to the chest or the chest is coming closer to the knee. But the movement of bringing the knee towards the chest really involves the hip joint, which is actual hip flexion, as well as the joint at the pelvis. Now, when you have hip arthritis, you lose motion in the hip joint. You lose space between the ball of the hip and the socket of the hip. Furthermore, a lot of people with hip arthritis tend to stand with a forward tilt of their pelvis, where they have a lot of arch in their lower back. But what that does is bring the socket of the hip down. So you're starting in a little bit of hip flexion already from the top down, where you're bent here. Then if you try to lift your leg, you have trouble lifting the leg. Or if you try squatting down, you have trouble squatting down because you're already in a little bit of hip flexion. And if you've lost some hip flexion from arthritis, you hit an end point a lot sooner than you probably should. So one tip that you can use right away to instantly improve your hip mobility, whether you're lifting your leg or whether you're squatting, is to start with a little posterior tilt of your pelvis, where you just roll your pelvis underneath of you. What that does is it flattens out your back. And that brings you into a better starting position where you're not partway through your flexion range of motion before you even begin the movement. So start out by tilting your pelvis towards you, and then you can lift your leg a lot higher like that with a flat back than if you tilt your pelvis forward and try lifting with an arched back. Furthermore, if you round your pelvis out and flatten your lower back and try squatting, you can squat a lot deeper with a flat back than you can with an arched back. So that's the first tip, to get your pelvis in a better starting position by rolling your pelvis under. Now the second tip has to do with the orientation of the hip joint. Many people think of your hip joints as the bones on the outside of your hip, but your actual hip joint is in the groin. And the socket of the hip faces downwards, outwards, and slightly forwards. The ball of the hip, in respect to the neck of the hip, faces upwards, inwards, and also slightly forwards. So the axis of rotation, if you purely spin around the neck of the femur or the neck of the hip, is kind of up and out like this. So it's not a pure flexion in this plane. When you have stiffness in the back of your hip from muscles or a tight hip capsule, a straight flexion movement causes the ball to roll upwards in the socket and pinch on the joint surfaces. And again, if you've already lost some space in your hip joint from having arthritis, you don't have as much margin of error when you move in a straight flexion plane. So if you are putting on your shoes and socks or stepping to get in a car, if you move your knee up and slightly outwards like that, rather than straight forwards like this, you can usually get a little better range of motion going in that direction. Furthermore, when you're squatting, if you turn your legs out and widen your stance a little bit, you can typically get deeper like that than you can if you have more of a narrow stance with hips straight forward, where you get blocked a little bit sooner. So again, to review those 2 tips, number 1, roll the pelvis under, flatten your lower back so you're in a better starting position of your hip joint, and then go into hip flexion or hip flexion. Number 2 is widen your stance a little bit and move the hip in sort of an up and outward motion like that if you're lifting your leg, or squat like that. Combining the two tips, it makes it a lot easier to improve your hip range of motion. Now, I did mention at the beginning of this video that there are some things you can do to further increase your range of motion by loosening up the capsule and the muscles in the back of your hip, which stop you from going into a straight plane hip flexion. Seeing a physical therapist for hands-on manual physical therapy can help improve that mobility in your hip rather quickly. And if you are in the St. Louis area, we'd be happy to help you out with that here at More for Life. But if you're watching this from somewhere else and you need some tips you can use at home, check out this video on hip mobilization exercises that you can do at home. But before you go check that one out, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.